My name is Ardalan Minokade. I'm a dermatologist in West Hollywood, California. I'm the youngest of three boys. My middle brother, unfortunately, was diagnosed with ALS. I'd like to have my oldest brother, Anush Shirvan, who's also on the call, introduce himself, and then I'll start with a prepared statement that my brother Shah wrote, and Anush will finish.
Great. So thank you again. Yeah, it's my pleasure to be here. My name is Anush Minakata. I'm the oldest of the three brothers. We're all physicians. I'm an anesthesiologist and I do neurointensive care, critical care, neurointensive care medicine, and I'm at UC San Diego. Um, and we've been witness to a lot of the things that you mentioned since 2011, since his diagnosis, and so we're rather passionate about trying to get this bill passed. So thank you so much. I think Adnan will get started with Shayar's statement.
Yes, and he wrote this, what I'm about to read. Thank you for this opportunity to tell my story and advocate on behalf of myself, the ALS community, and all patients and loved ones affected by neurodegenerative diseases. As a brief introduction, I grew up in New Orleans, Louisiana, as the son of an anesthesiologist and one of three sons who all pursued a career in medicine. I was accepted into an accelerated medical studies program where I finished the bachelor's degree and medical school at the age of 24. I went on to train in anesthesiology at Johns Hopkins and subspecialized in pain management at UC San Diego. I felt on top of the world and was in the prime of my life, having just met my future wife when I received the devastating diagnosis of ALS at 35 years old. This was a complete shock as I was otherwise healthy and had no family history of ALS. I received my diagnosis from a physician who was an expert in ALS and had, by his own account, dedicated 30 years of his life to seeing ALS patients and studied the disease. Despite this, there was no actionable guidance on what to do. This was not a new disease. It was first described over 150 years ago, yet there was no treatment that offered even a 1% chance of survival. There were no solid answers on what, if any, dietary changes I should make or whether or not I should exercise or not exercise to strengthen muscles. I was fortunate to find a small clinical trial and enrolled despite an inhumane protocol that would leave 1/3 of the patients without actual treatment during or after the trial. As a physician, it was unimaginable that this had been allowed in a 100% rapidly fatal disease. But let's fast forward to today. I've been locked out of any clinical trials or access to investigational treatments since 2013 because of trial restrictions. My family, friends, and I have corresponded with the FDA, pharmaceutical companies, and neurologists countless times. Despite my own medical background, knowledge, and connections in medicine, I've not been able to access a single investigational therapy for 7 years. The existing pathways of right to try, compassionate use, or expanded access to this day have only been empty words used to tell the hopeless and dying that something has already been done for them. I and many other ALS patients heard these words repeatedly, and unfortunately, most died while they fought and realized that these pathways provide no access for ALS patients. It's horrifying. And this ALS horror can happen to anyone at any age. ALS is classified as a rare disease because we die so quickly that our numbers remain small. ALS is not rare. I feel it's worth saying again. ALS is not rare. This can happen to you or someone you love. I'll pass this to my oldest brother to continue.
So my situation is not unique. This is the current horrific reality for everyone affected by ALS. This is why passing the Act for ALS bill in this Congress is so crucial. Delaying the passage of House Bill HR 8662 and its Senate companion bill S 4867 will result in tremendous suffering and death by withholding access to treatments for terminal patients. Patients like myself can benefit from promising experimental therapies and benefit from the funding of expanded access programs and open label extensions. It is quite literally a bill of life or death. Concurrently, it maintains FDA oversight. It accomplishes the FDA goal of collecting more data. It gives people with ALS the same expanded access to promising therapies as Americans with other common disease. Act for ALS speeds up development of potential life-saving treatments by creating a grants program that invests in promising neurodegenerative disease research. Act for ALS facilitates greater coordination of federal government efforts in the fight by creating an HHS collaborative for neurodegenerative diseases. The HHS collaborative will pull in patients, physicians, advocacy groups, researchers, and drug manufacturers at the same table with the FDA, NIH, and CDC. This will allow a much more efficient and effective partnership to tackle the scientific and regulatory challenges with neurodegenerative diseases. This bill is humanity. This bill is science. This bill is long overdue. I urge you to join our colleagues on both sides of the aisle and co-sponsor Act for ALS today. Thank you for your time. Sherry Arminukade, 44-year-old physician dying of ALS.
Thank you, Shah, for sharing your words and for being so courageous. We honor you. Dr. Sinnott, Bob Sinnott, would you like to go next?
Oh, sure. I'm Bob Sinnott. I am a colon rectal surgeon. I was diagnosed officially in January of 18, although I had issues prior to that. I had limb onset. I had surgery on my ulnar nerve and then surgery on my cervical spine. But I really didn't make progress, and I was officially diagnosed. Um, like many docs, I sought additional opinions, and the diagnosis was always the same. And I realized then that neurology, their most important role is to make the diagnosis. And there's very little to offer after that. All of these evaluations, I was told there were two drugs that basically don't do much. And then you're offered the opportunity for a clinical trial. And as has been stated, there are so many exclusion criteria that many people can't participate for many reasons. My personal journey is I initially was in the brainstorm trial, but I couldn't reconcile to myself or my family the 50% chance of placebo. Therefore, I traveled to Seoul, South Korea for a stem cell treatment with neuroprotective agents. Now, imagine that I'm a doctor in this great country, and I had to travel to South Korea. I was fortunate because I had the means, but most people can't. It's expensive, and it's a 14-hour plane trip. So, excuse me. So I urge everyone to support these bills to allow people to have at least a chance in the fight. Because right now we have, it's not a fair fight. There's nothing available outside of a trial to give us a chance in this fight. That's why I went to Seoul. I think the expanded access makes sense. I think what we're asking in these bills makes total sense. I can't imagine why any politician would not support it. This is not a partisan issue, and I urge everyone to please support this legislation. I'll stop at that.